Hi, I'm Virginia from the International Medical Writers Association, and here today we've got an expert on SEO, and his name is Geoff. Thanks so much for being here today, Geoff. Would you like to explain who you are, what you do, and what you're going to present on today?
Absolutely. Thank you, Virginia. Good morning, and good morning to all the members. So my name's Geoff Meakin. I have been doing healthcare SEO for over a decade now. And today I'm going to be talking about AI, SEO, and the future of healthcare writing. So very interesting, exciting topic. And yeah, looking forward to talking about it in more detail.
Perfect. Thank you so much for being here today. Do you want to go ahead and share your presentation?
Absolutely. Bear with me one second.
Ready when you are. Go ahead.
Okay, great. So AI, SEO, and the future of healthcare writing. So this is looking at how to turn health information into measurable clinic growth. I have focused a lot on private healthcare clinics. That's my kind of bread and butter. Obviously, some of this may need to be adapted if you're working for other healthcare organizations, but the principles will still remain almost exactly the same. If you're not sure, then always feel free to reach out to me. I'm very active on LinkedIn, so happy to answer any questions that anybody has after the presentation. So just a little bit of setting the scene, I suppose. This presentation is mainly for those who are freelance healthcare writers. You people out there, you're already skilled wordsmiths. You know how to communicate complex clinical information safely and accurately. But there is, as you have probably already noticed, a big change in the industry at the moment. Big change across all industries, to be perfectly honest, to do with AI. And clinics no longer just want health information. What a lot of clinics want now is for you to drive actual measurable outcomes. So that might be something like companies wanting more sales of specific healthcare products. It could be clinics wanting more inquiries and consultations, obviously, or it could be charities and nonprofits who want more visibility, awareness, and donations. So really, what we're looking at here is the best way to ensure that your clients, whoever they are getting the most out of your service. And as I said before, the rapid increase of AI overviews and search results and the rise of chatbot platforms like Claude, ChatGPT, Perplexity, it's really becoming more and more difficult to know if what you are writing is actually working and helping clients. And the more that you can help clients and demonstrate to them that what you're doing is helping them, the more likely they are to keep you on and continue using your services. So, as I say, the goal here is really measurable online growth. And to do that, I've built what I call a framework. I describe it as the COBALT framework, and it stands for conversion rate optimization, on-page optimization, backlinks, AI and content marketing, local SEO, technical, and tracking. Now, within your remit as a writer, it can actually touch on all of these things. You may think, I just write posts or I just write articles, but actually you can get really involved in each of these stages, and what you do and what you write can impact each of these stages. So I think there's a lot there to kind of unpack. And the first one is conversion rate optimization. So that means making sure that people who visit the site actually turn into either inquiries, they turn into customers, they make a donation, or they raise more awareness if it's a not-for-profit. So this is actually very important, looking at how people act once they're on the site. And there was, I think 2 years ago now, an algorithm leak from Google which showed that they do actually look at user behavior. They look at the way that people interact with the site. So your copy, what you're writing, has to resonate straight away so they don't click back to the results. And the website itself has to keep them engaged enough that they continue to read more information. So the key to that is writing for the patient, not the practitioner. And certainly I see this a lot of the time. Virginia, I don't know if you see this, but a lot of the time, clinical practitioners will focus very much on their credentials. They will focus on their research papers. They will focus on what separates their experience from other practitioners. as a healthcare writer, I would always encourage people to write as much as possible for patients and helping patients identify their own pains, their own problems being reflected back to them. The reason for that is that if you can engage somebody straight away on the website, they are more likely to stay on that web page. If somebody clicks through to the site, they look at the first page and they think this isn't really for me, they don't get it, they're just talking about their credentials, the chances are that they're then going to bounce back to the search results and pick another result. That's a really bad signal, and we don't want that at all. So one thing that you can do is use a tool called Microsoft Clarity. This is a free tool. It's something that you can recommend to your clients that they install, and it shows you exactly where people are visiting the site and where their attention is focused. So if you see that, for example, the people visiting your client's website are very much focused on pricing, then that's something you can recommend that you go in and make some edits to the pricing section. Again, on the right-hand side here, you can see the way that Microsoft Clarity actually color codes this. So the sections in red are sections that get a lot of attention on the page. The sections in yellow, medium attention, and the sections in blue, less attention. So this is really, really good. It's something that you can go back to clients and say, look, a lot of people are looking at this particular section, so we need to make sure that this is very compelling. Perhaps we need to rewrite it, perhaps we need to expand on it, whatever it might be. And really driving people towards those conversions that are going to be impactful for the clinic. The next section of the COBALT framework is O, which stands for on-page optimization. I've put it down here as SEO fundamentals. Now, this is going to be, I would say, 80% of what you do to SEO optimize or geo optimize a website nowadays. You want to make sure that the keywords, so the things that you want the clinic or client to show for, are here in the URL. So that's number one. So that's in the actual website address. If, for example, you're talking about heart conditions, you want to make sure that the term heart conditions is in the URL. And a lot of people now, they make it very, very complex and difficult to follow. There's lots of different rules in the SEO industry and lots of contradictions. But stripping it right back to basics, if you have the keyword in the URL, that's going to help you a lot. Likewise, number two here, we've got the page title. So this is what people see when they're going through the search results. I might have so that's right here. You can see here this purple section here. I'm sure everyone's familiar with this. This is the search results. Your title is what shows up directly in those search results. So that's really important. That's oftentimes the first interaction that any patient is going to have with your client's website. So making sure that that has the keyword that you want to rank for in it is very important as well. The third thing on here is the H1, and that's the visible headline on the page. Now, the H1 doesn't necessarily have to be massive. A lot of people get confused about this, and sometimes they will use the headings in order to format the text so that heading 1 is big, heading 2 is smaller, heading 3 is smaller still. And they will confuse things and they'll confuse search engines. So they'll use a heading 1 because it's nice and big for a big piece of copy they have that doesn't really convey what it is that they do. So my suggestion is always to make sure that you have the keyword within the H1 part of the web page. And that H1, you can edit it so it doesn't have to be massive. If your client says, I'm not happy with that, that's taking over the page, it can still be small. It can be somewhere else on the page, top, middle, or bottom. Ideally the top, but having that H1 there with your keyword in it is absolutely, I wouldn't say essential, but very, very important for your SEO optimization. It also reinforces when people click on your result in the search results and they go through to your website, they see the keyword right there in the H1, usually at the top of the page, and it reinforces to them, this is the page that I want to be looking at. Again, if somebody were to see something in the search results that said cardiac conditions, they click through on it, and then the very first title that they see is, I don't know, how to deal with a cardiac arrest. Like, while that might be a cardiac condition, it's not necessarily the information that people want. So making sure that it's consistent across all of these, again, is very important. And then finally, I've got the body copy here. So making sure that you mention the keyword actually within the body text is very important. And a lot of the time now, a lot of SEOs talk about the fact that you don't, they'll talk about keywords are dead. You don't need to worry about keywords anymore. While there is some truth to that, Google isn't necessarily looking for those specific keywords, but you will get a lot more visibility and you'll make it a lot easier for yourself by using the keywords that you want to rank for. Hopefully that makes sense. But yeah, these are your basic core fundamentals here. And if you just do these 4 things, that is 80% of your SEO work done. So try and focus on these first and foremost before you go worrying about other things like schema or canonicals or anything like that. This is your ground level SEO work that you should be doing on all pages. The next topic after this is actually backlinks. So this is, again, a lot of clients that I speak to get confused about this, and they think that backlinks is about linking from their website to other people's website, when in fact it's actually the opposite. What we want is for as many people to talk about our clinic or our client's clinic as possible. And this is still the case with AI search coming up. AI search doesn't necessarily need a link, but it does look at the mentions. So if everybody is talking about a particular hospital, then that hospital will become more well-known within the AI platforms. So essentially, to boil it all down, what you want is as many websites as possible talking about your site and linking to your site as well. And there's a few different ways that you can do this. One is by leveraging partner companies and brands. So obviously a lot of companies, particularly in private healthcare sector, they will work with other companies. They will have maybe an imaging company. They may have a procurement company. They may have, I don't know, like a medical secretary company. You can leverage those partnerships in order to get links. So you can say to them, if we leave you a testimonial that you can use on your website, perhaps you can link back to us. Or we would like to write a post about how much your company has helped us. Again, you can link back to our website. So that's one quick, easy way of getting links. And then, of course, for you as a medical writer, you are actually the person that can write those pieces of content for them. The next one is answering journalist requests. So for this, there are different platforms. There's Help a Reporter Out, there's Quoted. Help a Reporter Out is sometimes called Harrow as well. Response Source in the UK. This is where journalists will be looking for experts to quote within their work. Often it's doctors, psychiatrists, psychologists, somebody who really knows the field well. And so journalists will put this information out. They'll ask for people to come back to them with these expert insights. If you can be the person that provides those expert insights on behalf of your client, then that's another very good way of getting very strong links. And you can get links from really powerful websites like The Guardian, The Independent, these sort of really high-level publications just by doing that. So that's something that I'd highly recommend. Writing press releases as well, if there's anything going on within the company that you're working with, whether that's opening a new service, changing their staff members, maybe there's a new CEO, maybe there's something that they have proprietary data about. So, if your client is doing any work that has a research element to it, that can be put out as a press release that says, our client did this, and then news outlets will pick up on that. They will report it and they will link back to your website from that press release, which is obviously very helpful. Optimizing 404 pages, I wouldn't worry about that too much. That's a little bit technical. It involves looking for pages that no longer exist and then redirecting those to your website. That happens a lot more now with AI because AI hallucinates a lot of URLs, so that's something else that can be done. Publishing unique data, again, I touched on this talking about press releases. If you have any sort of unique data that you can draw on, or even government reports, those are really, really helpful for building up data which you can then put out there to journalists and have links come back. Events and speaking opportunities, again, anything that your client's doing that involves maybe like a seminar or a webinar or a conference, all of those are excellent for getting links because the organizers will link back to you when they're talking about, we have this particular speaker. So always try and be in contact with your clients and saying to them, what do you have coming up in the way of events and speaking opportunities? And podcasts as well is an excellent one because there are platforms that you can use. I think Podmatch is one of them, whereby similar to the answering journalist requests, podcasters will actually actively be seeking experts in a particular field. If you can get them on those podcasts are then syndicated and you get backlinks from those podcasts, which is a nice, easy, quick win for you too. Now, the next topic in the COBALT framework is A, which is for AI and content marketing. Now, I'm going to spend a little bit more time on this one because this is probably the one which is most important to you as medical writers. And the number one thing to know here is about query fan out. This is related to how the AI platforms actually work. The main thing that you need to be aware of is that when you put a prompt into AI, it doesn't just go out and do one search. So let's say you're looking for the best sun cream if you've got eczema. It won't just go out and search for that. What it will do instead is expand that into multiple topics. So it might look for the price of sun cream, eczema conditions, to be how eczema is affected by the sun, where to buy eczema specialist sun cream, all these different topics. It will go out and it will retrieve them, it will put them all together, and then it will give you the AI answer. Now, the more you can cover those different topics, the more likely you are to be cited and mentioned within the AI answer. So I understand that a lot of writers currently are very nervous about AI and AI taking their jobs. But this is where you can actually really prove your worth as a writer by explaining, look, this is how it works. And these are all the topics that you can cover in order to be returned as that number one answer. So just understanding that gives you a big leg up in terms of promoting your own services and being able to offer a service which meets that new requirement, essentially. Other items in terms of AI and content marketing, clarity. So making sure that your answers are very specific, clear, and concise. That makes it easier for the AI platforms to pull your answers out. Deep research. Again, this is very good and very accurate for doing research on your behalf. Google is one of the only companies that I know of that actually fact checks its own AI answers. So that's really helpful if you're doing research. I would highly recommend using Google Deep Research. Mentions. So this is something else that you ideally would be doing, is tracking where your client is being mentioned in these different platforms. And there's different tools for that. I am developing my own one currently for the healthcare sector specifically. But again, this gives you the opportunity to say to clients, these are the topics that your patients or customers are searching for. You don't currently show up in ChatGPT for these topics, or you don't currently show up in the AI overviews for these topics. And here's how we can address that. Again, coming back to the query fan out. So really knowing where you are and where you aren't shown is very important. And again, a lot of the clients that I speak to these days find that really, really useful. They're getting to grips with it all. So if you can shine some light on that part of it for them, that's very, very helpful. And that sets you apart from other writers, I think. Multimedia as well. This is something where you can offer to draft scripts for YouTube, medical explainers. In my own research, I found that YouTube is actually the number 4 most cited source of information within AI overviews. So it's very, very powerful. Whether all of those YouTube channels are adequate or high content quality is another question. But if you can start getting your content into YouTube, and Virginia, I'm sure you can speak to this, the more ability you have to actually influence those AI overviews, which is, again, obviously a very important thing. So just a little bit more about the prompts, the query fan out technique that's being used at the moment by these AI platforms. Just an example here, if you type in private cardiologist London, you will get lots and lots of different variations and different sub-questions to that. Generally, one prompt will result in 10 to 28 synthetic subqueries. So that's a lot of topics that you can write about potentially. Not all of them will be stuff that can live on your website. One of the things that has been working a lot lately for particular industries is writing a best of list and actually putting that up there. Now, it's very spammy and it's almost what we call grey hat, I think is one of the terms. So in other words, it's a bit of a shady thing to do, to write a piece of content where you cite yourself as being the best. Having said that, it does actually work. So whether that's something that you want to do or not do, I would say is down to a conversation between you and your client as to whether that's a route to go down. But again, it does work. And you will see these prompts within the query fan out. So best cardiologist London, best hospital for cardiology in London. If you can write something like that and your client is happy to put it on their website, as long as you're not contravening any laws about disparaging other companies, that's something that you can consider. Another thing to note as healthcare writers is that this shifts away slightly from a traditional SEO approach where you would look for terms that are popular. With a lot of these queries, they're so specific that there isn't any search volume around them. One example I can think of is an addiction clinic that I work with. One of the sub-queries was private clinic for celebrities in London. Now that's such a niche, small query to perform that there's going to be no search volume around that in traditional SEO. But with the new landscape of AI, that's something that it picks out as being important. So writing that particular piece of content is going to be helpful. So again, this is moving away from what you may have been taught previously and taking a slightly different path, but I think it's one that we need as healthcare marketers to be aware of. I think I've covered this part already, so I won't dwell on that for too long. But then the next part of the COBALT framework is L, which is for local search. Again, you might feel like this doesn't really impact you as a healthcare writer, but for local search, there certainly are things that you can do. And again, AI is pulling out a lot of these aspects within its answers. So one of those things is the descriptions of pages. When you type in a particular brand, you'll see a description comes up for their local profile. And I've seen clinics that just have something very, very basic. We are a gynecology clinic. It's like, well, yeah, duh. But if you can expand on that and tell people the reasons why you are different to others, maybe that's fast treatment times, maybe it's more experience, maybe it's more of a one-to-one experience, whatever it might be. Writing those business descriptions is very, very helpful. You also have service pages within the Google Business Profile setup, which you can fill those in as well. That's very helpful. There's also weekly posts that you can do too, talking about news, events. It could even be links to blog posts that you've written, but things that show that the business is active and participating in the community. Things to draw people in. that's your job, is to get that visibility when people are doing searches that include near me or a particular location. If you can fill in this information, that's very, very helpful. And also with reviews as well. One of the things now is that Google is summarizing reviews, and you will often see this at the top of a Google business profile. When you type in a brand name, it will pull out phrases that are often cited within the reviews. So if you can get involved with this process, what I would recommend is that you suggest to your clients that when asking for reviews, that they request specific information. So, for example, I've put in a potential example here. So, knee replacement surgery, if they mention that, the doctor had an excellent bedside manner, if they can mention that. Again, you're not telling patients what to write, but you can guide them to say, it would be very helpful if you mentioned the procedure that you had, and anything that you felt was particularly good. Something like that. You're not, what's the right word? Again, you're not telling them what to say, but you are guiding them, because a lot of people, they don't know what to put in a review. So the more scaffolding and structure you can give them, the better. As long as you're not telling them this is what you must write, you're absolutely fine. And then last of all, we've got T, which is for technical and tracking. Again, this may not feel like something that is your department as a healthcare writer, but I would encourage you to get involved with it. At a minimum, if you could get access to Google Analytics or Matomo, so you can see website traffic, you can see the types of queries that people are doing, especially if you use something like I've listed here, Google Search Console, Bing Webmaster Tools. All of these are very, very helpful for showing that your work is having an impact and it's benefiting the client as much as possible. So I think that wraps everything up for the time being. So just to summarize, again, the COBALT framework stands for conversion rate optimization. So is the copy patient-led? Does it discuss their pain points rather than clinic-led and their credentials? On-page optimization, so are the keywords in the title, the H1, the body copy, and the URL? B is for backlinks. Are we generating links via PR, data, or podcasts? A for AI and content marketing. Again, have you looked at query fan out? Have you used deep research? L for local SEO. So are the local business profiles updated? Are the patient reviews specific? And technical and tracking. So are you using Google Analytics or Search Console to actually see the benefits of all of your efforts? I hope that's useful. Back to you, Virginia.
Thank you so much, Geoff. That was a really helpful and interesting presentation and really useful framework as well. So I really appreciate your time.
Thank you. Thank you very much for yours. It's always great chatting to you.
Thank you. And thank you to the audience for watching or listening. I hope you found this presentation helpful and you learned some insights from Geoff. If you'd like to find out more about him, I'll leave some links in the video description box below so you can check out what he does. And thank you for watching once again, and we'll see you at the next webinar. Bye.